using even modified essay questions for teaching purposes, using themes, common lectures, symposia, webinars, early clinical exposure, assignments, and projects are videos. Again, the how much clinical component, that is the vertical integration, is being applied, whether there is early clinical exposure, whether clinical lab sessions, videos, and explanations are being used. Contribution of clinicians in teaching the basic sciences, again, whether the clinicians are contributing, for example, applied anatomy or applied physiology sessions, where the clinicians are invited to contribute, and whether we are having these joint sessions or symposia. I gave you the example of malaria, for example. The number of disciplines can come together, psychology, pharmacology, medicine, obstetric gynecology, or pediatrics, under one session that all aspects can be covered. Similarly, the assessment, the methods which are used for assessment of written examination in integration system, modified essay questions, problem-based questions, or structured essay questions, extended matching questions, and assignments are assessment of students during PBL sessions, and the vertical modules, especially, for example, the ethics and personal professional developments, their questions can be added in the theory papers. And then whether we are having some OSCEs, where the communication skills are teaching to the simulated patients, are doing some basic physical examination, like measuring pulse and BP, etc., are being practiced. So that concludes my presentation, and the whole aim was to make you think and see whether what is level of integration being practiced in your respective institution. Thank you very much for your attention, and I will be happy to answer any questions.
Thank you very much. Before starting any questions, I will request Professor General Aslam Saab, can you give few comments? General Muhammad Aslam Saab, the Vice Chancellor, ex-Vice Chancellor of UHS, is here. General Aslam Saab.
Sir, thank you very much. It is always a learning process to listen to Professor Alam Sher Khan, and we wish him all the best of health. My question is, sir, in my opinion, when I was dealing with University of Health Sciences at that time, which had 45 affiliated and constituent medical schools within, my opinion is that currently in Pakistan, not all, but most of the colleges are having level 4 to level 8 of integration according to Harden's levels of learning, that is from nesting to complementary. Right. And my question would be an imaginary. Would there be a time when we will be able to develop the 12th step of integration that is beyond transdisciplinary, that will be merging? And when it is established, there will be a Bible book in medical sciences and Bible teachers having a holistic approach, because whole is more than the sum of its parts.
That's right. So the reality is, or the fact of the matter is, that very few medical schools are practicing at that level, because it is not an easy task, and you need a lot of resources for that. So most of the institutions, for example, in Malaysia, I know they are at the level 8 or 9. And probably my feeling is that is the most appropriate for us under our situation. So if an institution is at level 8 or 9, I would be very, very happy for that level of integration, because beyond that, even the institutions who, for example, only few, let's say Dundee or some other institutions in US, and usually they are graduate medical programs rather than taking younger students. So I think to me 8 or 9 would be good enough.
Yes, sir. Professor Sher Alam, definitely in Pakistan, it is. I am not looking any of the institution running at the level of 11, but Azad Jammu Kashmir Medical College, we are almost in 9 and 10 level. Sir, we are running this integrated system since 2012, when the Professor Iqbal was founder principals and he started this. And hopefully, I think, as the General Islam told, it will take a holistic approach. I think a slow and steady. Most of the people from the since January this session, they are starting this from the first year, definitely. And Tariq Shahid Khan has given the comments. I will read it. Professor, respected professor, highly appreciated your excellent talk. The approach is basically multidisciplinary rather than too specific that I have seen and learned abroad. I would like to suggest that we need to design such curriculum program. By the way, I highly acknowledge Dr. Shahid, you are here. I think you are involved in multi policy system and with us. And can you give the comments, Dr. Shahid? Because Dr. Shahid, you are here. Shahid Khan, you are here. Okay, before the Dr. Shahid talk, Dr. Rashid Mahmood, you have raised the hand.
Yes, sir. Thank you very much, Professor Alamsher. You explained the thing which is apparently very old thing, but in a very different way. Sir, my question is about the actually not a question, you can say problem. That of course, our institution is trying hard. We think we are at level 6 or 7 or 8. The two issues which I think the students and we face. Number one is when we start teaching all the subjects from first year. So initially students used to purchase 3 books: anatomy, physiology, and biochemistry. Now students have to purchase all the 13 books. They have to search for the pathology book, for the surgery book, for the medicine book. And when they purchase the book and they go to the final year, the editions are then obsolete. So they have to see multiple books at a time for a small topic. For hemoglobin, they have to see 10 books. And second thing is that when we start teaching them from the vertical subjects right from the day one, they are not familiar with the basics. Like to teach a pharmacology in a good way, there used to be a general pharmacology. That takes many months that students should learn what is general pharmacology.
Yes,
Students must learn about the general pathology. What is general pathology?
Right.
Before going to the hospital, they should learn the basic clinical methods. Now we
Absolutely.
don't teach them as general pathology, general pharmacology, and we start teaching them the anti-tuberculosis treatment. So these two issues, please, you put
Right.
some comments on this.
So thank you very much, Prof.
thank you
Rashid.
very
You
much.
have
I will
brought
answer. Yes.
very important point. Basically, I did not mention, which I should have mentioned, that in integrated curriculum, the first module is a general module. And that general module may be from 12 weeks to maybe 6 months. And in that module, all the things which you are saying, the general things, general anatomy, general physiology, or general embryology, they are taught. And that's so the students are brought on the same level field before they go to the real integrated modules. So and again, it helps because if students are coming from different backgrounds, so this general module or foundation modules bring them at the same level. So you are absolutely right. We cannot implement integrated curriculum without having a general module. and general module would equip the students for this. And number two, the question of many books, Prof, this is time of e-books, no more paper books.
Yes, no more
And
paper.
yeah, and students can, it's so easy to find the information now, just with click of a mouse, you can find all the information. So we cannot use the old resources to apply the new concepts. So we have to move from, you know, you are absolutely right. By the time the book is completed and printed and comes into the market, it's already 4 or 5 years old. The knowledge has gone even beyond that information which was given in the book. So let's move on to the modern methods of these things. And as far as buying of these books is concerned, you have, if you want to buy, you have to buy now or later. So, but I would suggest, Prof, can I really share with you that
Sure.
honestly, I have not read a formal textbook in last maybe 15 years. I get always the latest information from the latest websites, and hardly read any book, but mostly ebook. I keep on updating my knowledge, but all based on the ebooks rather than on the printed books. So I think and the other important component when we want to implement integration is clinical skill lab. That's very, very important. A good clinical skill lab is a very, very important component of integrating curriculum. Now, talking about the integrated curriculum, I remember as a medical student, we were totally in isolation, fragmentation. And for us to have a simple coordination that all the basic sciences are being, let's say anatomy, physiology, and biochemistry, they are talking about the same subject discipline, seem to be an achievement. So I think we have to move on. And as Prof. Aslam said, that most may be at the coordination level, but then is slowly, gradually, I think we can move on step by step.
And sir, how to manage this?
Dr. Sher Malik, can I add few things for Dr.
Sure.
Rashid's question? Okay, you will be glad to hear that in Pakistan, especially RMU and Muzaffarabad Medical College, because we are running the system, they are developing this book which are based on integrated curriculum. You can even buy these books from Rawalpindi, because if you are going to teach one subject, this is not only being solved by the ebooks, as the Professor Sher Alam has told, but they are, with the passage of time, as this is becoming more and more popular. Dr. Ayub is here. Dr. Ayub is our director of the student. Dr. Ayub, can you comment about this, that how we are solving the problem of our students from the last 11 years? Because we are not, our students are not concerning the journal books, list of the so many books. So this is Dr. Ayub. Dr. Ayub. Yes, Dr. Ayub. नहीं, Ayub is there. Professor Ayub.
अच्छा, ख्याल में सर अगर नहीं है तो मैं इसी में एक चीज और जो अगर मैं पूछना चाह रहा था कि सर व्हाट अबाउट से अगर हम आई में पढ़ा रहे हैं, कैटरेक्ट पढ़ा रहे हैं और देयर आर 100 स्टूडेंट्स, तो आइडियली ऑल 100 स्टूडेंट्स शुड गो एंड सी द पेशेंट्स ऑफ कैटरेक्ट, और वार्ड्स में इतनी गुंजाइश नहीं होती कि स्टूडेंट्स दे आर रोटेटेड, 15 स्टूडेंट्स दे आर गोइंग टू आई वार्ड, दी 15 आर गोइंग टू ईएनटी वार्ड, 15 आर गोइंग टू गायनी वार्ड, तो उधर स्टूडेंट्स गायनी वार्ड में जा रहे हैं और उधर पढ़ा रहे हैं, उसको हम पीडियाट्रिक्स हैं, तो इसको कैसे मैनेज करते हैं?
इसमें सर एट द मोमेंट जो है the clinical years में स्टूडेंट्स आर रोटेटेड. लेट्स से हमारे ईयर 3 में 5 या 6 पोस्टिंग है, पीडियाट्रिक है, मेडिसिन है, सर्जरी है, ऑब्स्टेट्रिक गायनेकोलॉजी है, मे बी साइकेट्री है. So students are divided into small groups and फिर उनकी जो postings हैं, they are rotated. So obviously not 100 students can be accommodated in one discipline. So they वो rotate करते हैं.
रोटेट करते हैं. Dr. Sharma Kundi, Professor Sharma Kundi, Principal
Thank you.
of Ahmedabad Medical University and ex-president of PMA. Professor Sharma Kundi.
Thank you so much, Professor Mulazim Saab. It was an excellent talk
Thank
by
you, madam.
Dr. Alim Sher Saab. It was really, really fascinating. The only concern I have is that we get students in first year, they are never exposed to clinical wards, to hospitals, even the students of second year. And they're taught a bit of medicine, a bit of surgery. And somehow when they get exam questions, those are all clinical based scenarios and the students are not exposed to it. It is the 5th year that we have adapted the system, courtesy the KMU, our University of Khyber Pakhtunkhwa. Every college is supposed to be by notification of the Provincial Assembly. It has to be affiliated with that university. And they have the system, but it's a grave concern for me. They're not exposed to the clinical scenario and they're getting questions which are a little high level for them, like the questions which a 4th year or a final year student can solve. How can we overcome this stepping stone? Thank you.
Madam, if I may share my experience. Now, what we call is early clinical exposure. Let's take the example of cardiovascular module in phase 1, or so-called preclinical. Now we teach so many things in, let's say, the ECG and the other things, the cyanosis and the Peller. And so what we do is that in the last week of their module, for example, it's a 6 weeks module or 5-week module. In the last week of module, we rotate these students to the clinics. We bring them to the hospital and show them what we have taught them earlier. We show them what cyanosis looks like. We show them what Peller looks like. We show them how we take blood pressure. We show them how we talk to the patient, how we communicate with the relatives. So this is what, and some of these things we can do in clinical skill lab as well. So this is what we call is early clinical exposure. Now, if we use clinical scenarios for questions, but the questions are basic sciences. If the scenario is a patient comes with cyanosis, scenario can be any scenario, any clinical scenario, but most important is what is question being asked. And if on cyanosis, we are asking let's say this is a person who has a respiratory difficulty and presents with, let's say, difficulty in breathing and cyanosis, and we want to ask the pathogenesis or pathophysiology of cyanosis. So we are asking basic science questions in relation to clinical, so that gives student an idea that how these things are being applied in real life situation. So to me, scenario is not that important. As important is the question which we are asking on that scenario. If the questions relate to basic sciences, and again, there is a very a wrong concept in some of us, that the problem-based learning sessions, we have made them problem-solving learning sessions. Problem-based learning is to learn about the problem, understand about the problem, and not necessarily solve the problem. It is the case-based learning which would be in the clinical years, where they have to solve the problem by applying what they have learned in the preclinical years. So I think there is some confusion, some misconception in and the PBL sessions, that the scenarios used in PBL sessions are clinical scenarios, and the same scenarios can be used in examination, but the questions should be related to basic sciences, not to clinical sciences in year 1 and year 2 at that level. I hope that answered your question.
Yeah,
Dr.
thank you so much. That means we have to contact our university. Dr. Rashid is from the same university, and the paper setters have to be trained properly so that they give different levels of questions for every year. Thank you so much, Dr. Alam sir.
Dr. Anila. Dr. Anila Jalil. Dr.
Hello.
Anila Jalil.
Ji, Assalamu alaikum. I am
Walaikum assalam.
Dr. Anila, Professor Anila from Shalimar Medical and Dental College.
आपकी आवाज नहीं आ रही.
Madam, you are muted.
Unmute.
Please unmute yourself.
Madam, unmute. Okay. Dr. Anila is from Shalimar Medical College.
Please unmute yourself.
Okay. Any else? But
Yes, madam.
Sir, just I want to ask that in a curriculum, integrated curriculum, in a module, how you overcome that thing that of supposingly if a subject has less weightage, and when you examine the module according to the table of specification, then there's a chance that the students may not study that part of it which has less weightage in that system. So how we can overcome that?
Right. That's very interesting question. I may share that what we used to do in medical school when we were students. Some of our friends would staple a whole chapter in the book, that no need to read about it because there wouldn't be any question, or would be only very less number of questions from that. But in integrated curriculum, as we mentioned during the presentation, the main emphasis is on the core curriculum, not on minor print. So we have to remember that these are undergraduate medical students, and we are preparing them to be a house officer. We are not preparing them to be anatomist, physiology, or biochemistry, or a specialist. And our examination questions should be based on the major areas, the core curriculum, rather than on minor prints. Minor prints would come in play when they go for specialization. For example, if you are going for a specialization in surgery, the whole anatomy would be taught again. And that's the time where the minor prints should come. So in our undergraduate, the emphasis should be on major components. And again, probably the passing mark should not be 50%. It should be high, because when you are doing the core curriculum means that something which you must know. Core curriculum is you must know. If you don't know, you may not qualify for that. So we need to think about that.
okay.
Thank you, sir.
Dr. Nigat Nadeem, you are the earliest participant in this webinar. Dr. Nigat.
Thank you very much. I'm Dr. Nigat Nadeem from LMDC, Associate Professor DME. Dr. Alam Sher, thank you very much. First, you are always, mashallah, very informative. My general reservation is, I have also written in the chat, one, I would like your comment on the assessment for level 8. And secondly, I would like to ask that, is there any bar that we have to have in assessments, SAQs or MEQs? Can it only be on MCQs? And thirdly, if we are correlating or complementing our subjects in first, second year, like anatomy with surgery, clinical radiology, and the other two subjects, physiology, biochemistry, with the pathology, community, and some other subjects like medicine or rheumatology even. So when we are going to give them assessment for these subjects, anatomy, physiology, biochemistry in the first 3 years, are our scenarios going to complement what we have taught them, say in a spiral, with the other subjects which were actually going to be taught in third, fourth, final year? Or they are just taught, but their element in or weightage in assessment would not be the same, or is it necessary to be the same? Thank you.
Right. Now, madam, the first thing we need to realize is that no single method of assessment is perfect. We have to have a combination of what they call is menu of assessment methods. So only MCQs or only one method may not be sufficient. So usually we combine the methods, so weakness of one method are covered by the strength of the other method. That's number one. Number two, we should realize that not everything we are teaching must be examined. And there would, you see, we have some very introductory sessions in first year or second year where the clinicians and physicians or surgeons are coming. Main aim is to create an interest in the student and to show them the relevance. So it's not necessary to examine those things because the purpose is to create or to motivate the students. Thirdly, as we said earlier, it is good to use clinical scenarios, whether we are using modified essay question or structured essay questions or extended matching questions, that gives the feeling of relevance to the students. But questions should be according to their level. You can have a rheumatology, for example, scenario, but the questions should be related to whether they are year one students or year two students. So based on for example, you are giving the restriction of movements, for example, of upper limb. That there's a person who cannot move their limb, but the questions would be which muscles or which nerves are affected.
Yes. Yes.
So as I said, the most important is what you are asking. As we know, the same books are used for undergraduate and postgraduate students, but their level of understanding and learning is different.
Even the same questions are being asked, same scenarios are being asked, but the question is different.
But
for the final year and for the first year.
Yeah, questions are different. So
Questions are different.
Let's concentrate on questions, the level of questions.
Level of the question.
Yeah.
Professor Munir, Muhammad Munir is our professor of pathology.
Sorry, can I just make one comment, Dr. Razim? Can I just make one comment?
Okay. Yes, you're.
Thank you so much. I'll just take a minute. I just want to say that in LMDC, we had been practicing early clinical exposure, and it's not very difficult before COVID, because you see after that, there was 1 or 2 years have not been very good regarding that. Anyway, what we used to do is one batch of the first and second year practicals used to go to our hospital, and surgery and allied and medicine and allied had made a proper perform of how and where they were going to take them. It was not in actual contact with the patients, but it was giving an awareness of the hospital environment, which prepared them by the time they will go to proper clinical wards in third year. And secondly, the most important thing is that if you can't take the students to the hospital, you can bring sometime if feasible the patient to the college. It can be converted into kind of a CBL. Maybe again, like you've said, the level of question, the level of teaching in these CBLs would be considering their first and second year students. So early clinical exposure is not that difficult, but what needs to be done in this is remember these are first and second year students, and our first and second year students are just coming from FSC and A level, and they are hardly 18, 19. Abroad, mostly the students are more mature, especially in America. They have to do a 4-year undergrad before they go for that. So we just need to keep the level of their interaction in clinical exposure in first, second year contained. Then it becomes very feasible.
Yeah,
thank you very much.
I think, madam, thank you very much for sharing that. What we do is that when we are bringing the students to hospital, we actually bring to different hospitals in the different wards. We, with the help of clinicians, we pre-select the patients. So when the students go to the hospital, we already know that which patients are going to be shown to the students and what are the learning outcomes. They are clearly identified. Bringing the patient to the students is another solution to that issue. Thank you very much for sharing that.
Professor Mohammad Munir, the Professor of
Thank you.
Pathology and Director of Student Affairs in fourth year, MBBS Azad Jammu Kashmir Medical College. Dr. Mohammad Munir, you have raised the question.
Thank you very much, Professor Mulazam Hussain. It was a very nice.
And you are also a director of a library, sir.
You see, my question is, starts from the development of the curriculum. And I had been, involved in for the last 10 years in integrated system. My question is, what not to include in the curriculum?
Oh.
All right. That's very, very important, Prof. Very important.
Question.
The enthusiasm we have as teachers. I'm a pediatrician and I want my students to graduate like pediatrician.
This is the problem.
The physiologists want them to be the physiologist. So we should remember, number one, that we are producing house officers and they have another 1 or 2 years to learn before they start practice. So that's number one. So we are not producing specialists. We are not producing basic scientists. At the same time, we are not producing nursing students. We don't want to teach them how to make bed, right? And we are not producing pathologists. So we don't need them to do all the pathology techniques and that. So the best way is what we call is top-down approach.
What again?
Yes.
Repeat it. Which approach?
The top-down approach.
Top-down approach.
Approach
Yes.
from top. So just identify the attributes of a graduate. For example, a student is graduating. So what should be the level of knowledge? What should be the level of skills? What should be the level of attitude you expect from a graduate? And now you have the outcomes. You have the outcomes of the program, and the rest of the program should work towards that outcome. For example, commonly I talk about doing lumbar puncture. If you expect your graduate to perform a lumbar puncture, then now you know what kind of knowledge they should have, what kind of skill they should have, what kind of attitude they should have. So then from that, you bring these things down in the curriculum. For example, circulation of CSF, formation of CSF, the anatomy of a spinal cord. So I think that the starting point is from top down. Just identify the attributes of your graduate, and then so in that way you would forget about the minor things. You would concentrate on the major things.
Okay, Dr. Asif, Dr. Muhammad Asif from Sialkot. Dr. Muhammad Asif.
Yes, sir. Can you hear me, sir?
Yeah,
Yes,
clearly.
yes.
Oh, thank you very much, sir. I'm Dr. Muhammad Asif, Associate Professor of Surgery from Sialkot Medical College. It is a very good and excellent talk about the integrated session. I'm just inquiring about the e-resources you have talked about, that there are some e-resources which are available to us for the guidance of the students. Can you please share with us these resources so we can guide our students?
Right. Sir, if you just search on the net, but you have to be careful that what site you are searching. So try to find out the scientific sites, right? Like eMedicine, for example, and the Science Direct. So these are the resources. Some of them are free. And then again, coming to, I think YouTube is another very useful resource where a number of procedures and the methods are given. Similarly, it's one Khan's, something Khan, the videos and audios. They actually, honestly, I learn a lot from them because they explain in such a simple terms that sometimes difficult concepts, which I find it difficult to understand, they become so clear. So if you go through this and just spend some time and identify these resources, and in fact, your students might be helpful to you to find these resources. And as I said, many of them are free, so they can be used. Similarly, ebooks, some of them are loaded on the net, and they can be used. And it's so easy to read them because you can search very quickly. You can type your question and find the answer. And this latest buzz is this some chat box. So a lot of information is there in that as well.
Okay.
Professor Mulazim Hussain Bukhari, I have a comment.
Okay, you are allowed, sir. You are allowed.
Thank you very much, Professor Alam Sher. You have talked about the top-down approach. You have talked about the core content and the core concepts. I'm sure you will agree with me that the core concepts for a graduate student will be different than the core content for a nursing student.
Absolutely right.
I think this is the high time that the medical education experts from all over Pakistan sit together and develop the curriculum, integrated curriculum, which is uniform and which is employed.
Dr. Asif, please mute. Okay, yes, continue, Professor Munir. Professor Munir, you are okay. Professor Munir.
I think, sir, Professor Munir was talking about a central body which can help the
yes in the
medical schools, and I think UHS is in such position. I know that when Professor
Dr. Alam
Aslam
Sher, last month, I think two months ago back, Professor Abdul Wahid Rathore, Vice Chancellor, called the meetings of all the principals, and I think it was in the November or something end of this. And they made the committee and to make the uniform curriculum for this integration. And he has also advised all the colleges working under the UHS to start this in the beginning of the new session of this one. Okay, Doctor.
Sir, if I can just add, a university should have, let's say, about 70%.
Yes.
Common. Another 30% should be given the liberty to the medical schools that they add their own innovations and methods.
Sure.
I think that we should give that independence to medical schools as well.
Professor Dr. Dr. Masood Ilahi, you are our senior and very senior colleague. Because can you give few comments about it? Because what in the USA nowadays and what you are looking about the integrated system? Masood Ilahi.
Assalamu alaikum.
Wa alaikum salam, sir.
Actually, I was just joining to refresh my those other side that it is almost 2 o'clock midnight, or early morning here.
Oh, thank you very much, sir.
Thank you very
But
much. Sir.
still, because you invited me through the that group, and I was here, and Dr. Alam Sher, we used to be friends together. If he recalls, he and Tahir Mir and myself. So there was another attraction for me.
Right, sir. I'm sorry, I didn't realize earlier.
So no, it's never too late, Alam Sher.
Yeah,
It's never too late. But
yeah.
coming back to your this one invitation, that I have mostly been involved with the administrative issues, so I was not involved with the medical education issues. So it is my just as a learning curve. I was joining that one, and it was interesting.
Thank you, sir. Professor Dr. Masood Ilai is our senior Qaidian, and that is why I have a lot of honor for him, sir.
Professor
Okay,
Bukhari, we used to have good times together. No, no, when I recognize him,
Okay, last question, Dr. Rashid Saab, because time is over, there are so many other questions, but I will request them to send me on my WhatsApp group on our website, and we'll inshallah have another session, continuous session. And next coming session is Professor General Aslam on the heart. दिल को कैसे बचाना है, General Aslam साहब बताएंगे अगली दफा. अगले next Sunday we have continuous webinar. Dr. Rashid Saab, last question.
Yes, sir. मैंने सर ये रेज किया है एक रिक्वेस्ट के लिए, क्योंकि इस वक्त सारे स्टेक होल्डर्स और वेबिनार स्पेशल रहते हैं. ये वेबिनार हर संडे को होता है 11 बजे, और आलम शेर साहब एक बहुत अच्छा वेबिनार करते हैं महीने में एक बार. दोनों की टाइमिंग्स एक होती हैं और इसमें हमें बड़ा लॉस होता है. तो वो एक वेबिनार को हम कोऑर्डिनेट कर लिया करें ताकि वो डुप्लीकेशन ना आया करे, हम उसको ज्वाइन कर लिया करें.
Dr. Rashid, you know that this is the unique webinar that we have started from last year, and that is why we tried our best, but we failed to bring our participants, because not only the participants are here, certain students are there. So I think, inshallah, let's discuss with the Salma Kundi. Professor Salma Kundi, now it is over to you to conclude. Professor Salma Kundi.
Thank you so much, Professor Mulazim Saab. It was such a wonderful talk. I'm very, very thankful to Dr. Alam Sher Saab for enlightening us. And I'm thankful to all the participants. The man behind the gun of this show is Mulazim Bukhari Saab. Hats off to him. And I thank you all from the PMA platform for regularly attending these webinars. What Dr. Rashid said is something very cogent. What we can do is we can link it up with Dr. Alam Sher's, whichever Sunday he has. If he sends us the link, we will send that link from the PMA platform to our group as well.
Definitely.
And stay blessed, all of you. And I hope the medical education in Pakistan improves, and so does the standard of living of our fellow countrymen. May Allah bless all of you and Pakistan. Pakistan Zindabad. Have a good day. Thank you.
Thank you so much. Thank you so much. Once again, Professor Sher Malik, thank you very much. And you gave the time, and also thanks to all the participants. Inshallah, we will meet next Sunday with the lecturer, Professor General Aslam Saab.
Thank you very much, sir. Thank you for the invitation and your attention.
Dr. Alam Sher, this webinar is an integrated webinar, because sometimes we are conducting basic sciences and we are linking this basic sciences with clinical sciences.
You see, sir, my next webinar under MedEd webinar series is on 22nd of January, which is on 22nd. It is on developing the rubrics and marking schemes.
Okay, what is the time? Because we have also
it's the 11 o'clock Pakistan time. Actually, because Prof, I have participants from let's say about 23 countries, So if I just move the time, it
let us start. Our Dr. Alam Sher, our 22nd webinar is from the United States of America, Professor Sarvat, on the artificial intelligence, and that will definitely there will be the change of the time, because at this time there is a midnight, as Dr. Masood Ilai is saying, and our session the 22nd is late. It will be not on the 22nd, and it is 22nd webinar is intelligence, artificial intelligence. And before this is I have just announced after General Aslam Saab. Thank you so much, sir. Inshallah.
Sorry, sir. What time would be this artificial intelligence?
I will send you, because I will change the time. I will adjust the time with your webinar, sir.
Yeah. Please
आपने
let me
क्या
know.
बताया? आपका क्या टाइम है? 11 बजे?
जी, पाकिस्तान के 11 बजे.
नहीं, we will change it, sir. हम 7 को शाम की 7 बजे करेंगे.
सही.
Thank you so much, Ji. Thank you, all of you. Allah bless all of you.
so much.
Thank you,
so much.
General Aslam.
Oh, thank you very much. Thank you very much. God bless you all.
Thank you, sir. Thank you very much, sir.
Bye-bye.
Allah Hafiz.
Thank you, Alam Sher Saab.
Thank you very much.
Sir.
Thank you very much. Thank you very
थोड़ी सी ज्यादा डालो, थोड़ी सी